Welcome back on this gift of a Wednesday, the 15th of December 2021. This is your most favorite breakfast show, Good Morning Namibia, coming to you live from Cafe Anton in Swakopmund in the mighty Irongo region. Now, the Walvis Bay Corridor Group, through its wellness program, ensures that mobile populations such as truck drivers and other vulnerable key populations are continuously sensitized and screened for both COVID-19 as well as HIV, and that their core health and wellness interventions at facility level are maintained. Joining us with details is the project manager for wellness from the Walvis Bay Corridor Group, Mr. Edward Shivute. Good morning, sir, and welcome to Good Morning Namibia.
Good morning, Denver. Thank you.
From the onset, we'd like to know, to what extent does the Walvis Bay Corridor Group contribute to the fight against COVID-19?
Yeah, thank you. I think two keywords is diversification and stakeholder engagement. During, I think, for the past 18 months, as the Walvis Bay Corridor Group, I think we have come to find methods and strategies to integrate COVID-19 into our normal services. I think the contribution has really been in terms of medical services. We know that our main mandate is within the transport sector. We have expanded our services, we have diversified our services, and most importantly is that we have been very innovative in terms of how we provide our wellness services. We know that our services started mainly focusing on HIV/AIDS activities, but ever since we have opened up more clinics, we have actually expanded in terms of the additional services that are related to COVID, and also in terms of medical technologies, infrastructure that we use to provide these wellness services.
Now, there's consensus that your approach has always been an intentional one. Just briefly help us understand why diversification within the context of wellness in the transport and logistics sector is so critically important.
I think what conditions like COVID have taught us is that we cannot do business as usual. That is because the pandemic itself came as a surprise to many. And we have seen that by being innovative in how we do things will help us to continue surviving. And also within the transport and logistics sector is that we had to make ourselves relevant. And also we had the term that we use within the sector is to ensure that the wheels continue to turn. And by doing this, we have set up roadside mobile clinics. And for the first time, we have roadside wellness clinics along all the transport corridors in Namibia. And that means that we are bringing services closer to the people that actually need these services.
In your introductory overview, you mentioned that two features characterize your approach, namely diversification on the one hand, but also stakeholder engagement. Please talk to us about the collaboration and cooperation within the transport and logistics sector in the fight against COVID-19.
Yeah, I think I want to comment the transport and logistics sector because the biggest contribution from the transport and logistics operators really is to continue business because without the sector, we know that the movement of goods and also the movement of people would have been impossible simply by bringing medical supplies into the country has been a major contribution from the sector. And what we also realize is that this is a multi-sectoral approach. And no country, no sector would have done this or would do this on their own. And therefore, the contribution from the sector has really, in terms of even expanding our services, we have seen the sector also contributing to policy development as much as it has been hard in terms of economy and also in terms of the operations of the sector. The stakeholders has really contributed. We have private sector stakeholders like Engine, for example, who have contributed by availing space for us to set up clinics at their premises. We have at the coast also stakeholders within the transport sector who have set up a temporary quarantine facility since last year, and it continues to operate at some level. And also many companies have set up quarantine facilities within their own premises, and this is basically to make sure that the long distance truck drivers specifically are kept safe. And also in terms of medical supplies, many transport operators have actually donated a lot of medical supplies either to the Walvis by Corridor Group or to government, and this is really a multi-sectoral approach in play.
Now, you do what you are doing in service of your clients. Please talk to us about the feedback from clients visiting, especially the wellness facilities on the road.
I think the most important aspect was the integration and to the innovation to remain relevant, because we know that most of the people that have succumbed to COVID-19 was because of other medical conditions and not really COVID specifically. It's people who had, high blood pressure, people who were suffering from other medical conditions. And what we then decided to do is that apart from, doing your cholesterol test and glucose and giving you an HIV test and ARVs and so on, we want to integrate COVID so that we have like what we call a comprehensive one-stop package. And this has been appreciated by many clients. Case in point now is that all our clinics, we have 7 clinics now, roadside clinics plus 5 mobile clinics, and all of them are providing vaccination services, because a lot of people now, contrary to what is being said, a lot of people are actually coming forth now to get vaccinated. And the good news, as we had yesterday, is that everyone or most of the people are now eligible for a COVID booster. And this is what we've always been saying, that apart from, vaccines are not 100% anywhere in the world. We have the flu vaccines, 45% that we get a shot every year. COVID vaccines are here, and they are boosting us. So this is what we want to give people, and this is what the clients appreciate about our services.
As we're starting to wrap up our conversation this morning, what plans do you have in store, especially for the festive season?
Yeah, this is a very special time for us. I think historically we've always taken a break during this time, but for the past 2 years at least, we know that there's one thing that doesn't go on holiday, and it is our health. If you are having a medical condition and you do not take care of it, it does not go on holiday. Come January, that medical condition, if not taken care of, it will continue to bother you. So what we have decided, also in collaboration with the Ministry of Health and Social Services, is to keep our doors open and to make sure that with our mobile facilities, we go to various companies. We have a lot of companies now calling us to go test their employees for COVID, to go do vaccination, cholesterol, all these biometric wellness screening services. So during this holiday, we will be very busy. We will be here at the coast as well. We will be providing vaccination services. Along the corridors, our logistics operators must rest assured that all our clinics will remain open, and all the drivers, because now we know that it's becoming mandatory, especially in terms of vaccination certificates to enter our neighboring countries, we will be open. So truck drivers need not to worry when they want to cross borders. They can pop into our clinics, get their vaccination, get the cards, and that will ensure that the economy continues, the wheels continue to turn, and come January, we want to see a different picture, and we don't want to get to a situation where we were with Delta variant. So we want to save lives, and we remain committed to that.
Thank you very much. The reality is, unfortunately, COVID-19 doesn't go on a holiday.
Exactly.
Yeah.
Exactly.
Thank you for your time. Thank you for the great work that you and the Corridor Group are doing.
Thank you very much.
There you have it. That was Mr. Edward Shivute, Program Manager responsible for wellness at the Walvis Bay Corridor Group, reminding us to remain vigilant in the midst of COVID-19.